Bacteria, essential to life, but also the cause of some of the worst suffering our civilization has ever known. Cholera, leprosy, plague, meningitis, tuberculosis. Discovered in 1929, the miracle cure was penicillin. Large-scale production of antibiotics began in the early 1940s, and many thought the war had been won against bacterial infections. But today we're faced with a very different story. Antibiotics are losing their effectiveness at an alarming rate. Unforeseen just 5 years ago.
Well, I'm deeply worried about the situation. We have been sort of put into some kind of self-deception that antibiotics will always be around for infections. This is not the case. The basic driver of the problem is antibiotic use and misuse and overuse. This selects resistant bacteria. But then the other part of it is travel. Bacteria travel with us, it travels with the food chain, it spreads globally. The third thing is infection control practices are poor in many instances in hospitals and also in the community.
I think the most worrying trend in Europe is this emergence and spread of really multi-resistant bacteria in hospitals, bacteria for which we have no more antibiotics to cure.
On the 18th of November, many countries around Europe are marking the first European Antibiotic Awareness Day. The aim of this day is to inform the general public about when and how to take antibiotics and why responsible antibiotic use is so important.
So where do we start? What is responsible use of antibiotics? And who needs to understand the issue?
It's very difficult for a doctor to know whether a patient is suffering from a viral or a bacterial infection because there's no piece of equipment that can tell us immediately which it is. And even if they had a bacterial infection, there's no certainty that antibiotics would make them get better any quicker. In the GRACE study funded by the European Union, we found huge differences in the amount of antibiotics prescribed between countries that can't be explained away by differences in patients' symptoms. There are big cultural and healthcare system differences which determine that in some places patients are much more likely to get antibiotics than in others.
Antibiotic use varies throughout the EU, with each country facing its own set of issues.
I'm really deeply concerned about overuse of antibiotics in my country. I think, first of all, the Greeks should obey the Greek law, according to which they are not permitted to get antibiotics over the counter. On the other hand, they should learn that by over-consuming antibiotics, they destroy the antibiotics, and when they are going really to need them for a serious infections, antibiotics will not be anymore around. Young physicians, the students, the pharmacists, the politicians and the Greek consumer, all of us, we have to cooperate. We have to cooperate and learn how to use wisely antibiotics and how we have to save antibiotics.
One of the goals of European Antibiotic Awareness Day is to encourage further education and awareness-building programs. eBug, an education program targeting children, is one such initiative.
The aim of eBug is to teach children about microbes and how they spread, so that we can reduce cross-infection and therefore antibiotic use in schools. We also are teaching the children about the prudent use of antibiotics, so when they become young adults, they will use antibiotics wisely. The eBug pack is supported by an interactive website where children and their families can learn through gameplay.
I've learnt about the snot test, where we got a syringe and we sheeted water along this tissue paper and we measured how far it went. I learnt that you need a tissue to stop germs spreading.
Already, over 19 member states have agreed to use the materials starting in 2009.
Every citizen, healthcare worker, patient and consumer should be targeted and made aware of the dangers of improper antibiotic use.
The first ever European Antibiotic Awareness Day will take place across Europe on the 18th of November 2008. This year's focus is on stopping unnecessary use of antibiotics for common colds and flu. Further information can be found on the website antibiotic.ecdc.europa.eu.